In this episode, John discusses the distinctive features of Canadian healthcare with his old colleagues, Dr. Trafford Crump and Dr. Paul Woods. Dr. Trafford Crump is the assistant professor in the departments of surgery and community health sciences at the University of Calgary. Dr. Paul Woods is the president and CEO of the London Health Sciences Centre and is an associate professor in the Department of Family Medicine at Western University.
Thanks for joining me today, guys.
Thanks for having us.
So I thought we'd start off. Trafford, I think you would be a good one to answer this since you grew up in this system. I'd like you to start us off with talking about the Canadian healthcare system in general. I really think there's a lot of misconceptions here in the U.S. in our general understanding, even healthcare people here in the U.S. and wondering what the mystery of our neighbor to the north and what goes on up there in Canadian healthcare. So from your perspective, tell us a little bit about how healthcare is delivered and maybe what's a little bit, tell us a few things that maybe we didn't know about the system.
Sure. Yeah, well, when we're speaking about the Canadian healthcare system, and I'm kind of putting that in air quotes here, what we're really talking about is 10 provincial systems and then a territorial system that operates a little slightly different. But the 10 provincial systems are really sort of woven together through the Canada Health Act that outlines how healthcare is supposed to be funded and delivered in the country. So each province, which are analogous to the states here in the U.S., is responsible for the funding and the delivery of their respective healthcare systems under the guidance of the Canadian healthcare system. Now, most of those provinces have gone to a regionalized system where the provincial government is responsible for setting healthcare policy and funding the delivery of care. And these health regions are responsible for the administration of healthcare and also the delivery of care within their respective regions. So we're talking about really multiple systems that operate fairly similarly, and within those provincial systems, then a bunch of regions that, depending on the province, act like a healthcare system would here in the States, or perhaps something a little bit more social, incorporating things like public health responsibilities and health safety and regulation responsibilities. So that's really what we're talking about when we're talking about the Canadian healthcare system.
So it's an entirely socialist system then?
Well, only about 70% of the dollars spent in healthcare in Canada are publicly funded. The other 30% come from private. And so that's equivalent to, in the States, I think it's 59% public compared to 41% private. Because your Medicare system is so Medicaid and Medicare in the States is such a dominant force.
Plus the VA. I mean, there's other public health that
of course.
That pushes that number higher. Yeah.
Yeah. The primary funder is the government. Some provinces have healthcare premiums, which are just another fancy word for a tax that they bill directly to residents of their province. To try and I mean, the intent there isn't to fund the system so much as it is to help patients recognize that they're using a system that isn't free, but everybody's insured under the public system, so insurance isn't an issue. And then there are some exceptions to the Canada Health Act that would ensure specific groups of the population, like the Royal Canadian Mounted Police, prisoners, Indigenous population, through federal government means rather than through the provincial government. For the large majority of Canadians, we're covered by our provincial healthcare insurance plans, and that's the extent to which we have our health insurance.